A cheerful heart is good medicine, Proverbs 17:22. Hi, this is Robin again, and I wanted to tell you about my first IMRT treatment, also known as radiation therapy. I went yesterday afternoon, and I had just a little bit of anxiousness, but my husband and my daughter went with me, and there were 3 techs. They were all young ladies, and they were very sweet. They took me in, and because I'm getting radiation to the head and neck, I just have to disrobe jewelry, clothing from the waist up. And then you are given a towel, and you come in. They place you on the table. They lay you back into that foam piece. And it's real important, especially for the girls, to get as much hair behind you back into that foam piece behind your neck, so that when you lay down, it's really pulled back there if you have long hair. Then they have made a little rubbery piece that's probably half an inch wide, maybe, that goes over my scar. If you don't have a scar, you don't have one, but it covers the scar line. And then they looked at the lines they had made. That center of my stomach areas of my body is in line. And then they covered me up, and then they put on the face mask over the white piece. And that's where you really want your hair to be out of the way, because I had them come up again because my hair was getting pulled. And again, the face mask part is really tight. So then they said, because it was the first official real time, that they were going to go in and out of the CT a little bit to make sure I was in the right position. And then they said it was time to start, and they reminded me that should I need something that they could hear, but I wouldn't be able to really speak. So they said just to bend my knees up, and they would see it, and they would come in and stop and help whatever I needed helped. But that was okay. I didn't need that. So once it started, I think yesterday or the last session, I told you that I was going to hear stop swallowing, and that was the only command I would hear. But they said no, that was just for the simulation model being made. So I just heard a series of some long beeps and some clicking sounds that if you've ever been in a big machine like this, you've heard them before. There's no smell. There were maybe a few flashing lights here and there, but again, the way my mask is made, I close my eyes. So that took about 5 or 10 minutes, and then I got dressed and went back out to my husband and my daughter. And that was that. We did meet with a nutritionist, and she talked about what kind of diet I'm already on, and talked about things that would help. The 2 main things that she focused on was eat a lot of protein, a lot. And she actually gave me a number of, I think, grams of protein that I should have every day. And she said that calories were super important, because they just don't want me to lose weight, because if I lose weight, it would be muscle, and I really need to not lose weight, because I need the muscle to help not break down the radiation, how it might hit my neck and my face. I will say that about 2 hours after the treatment, we were headed into the mall, and I started getting a soreness. And the soreness felt like, when you go to the dentist and they give you some of those shots way back in the back of your jaw to work on back teeth. And then, like, they worked on those teeth, and they just kind of banged around a little bit. And it felt like right as the pain medicine starts to wear off, like you're on your way home or you're home, and that little bit of pain in your jaw, that's what it felt like. It wasn't too bad. When we got home, I was able to shop. When we got home, I did take some ibuprofen, and that took away about 90% of it. I noticed that the scar that's running down my neck was a little redder than normal. And then by this morning, that's all I did yesterday was I took the 3 ibuprofen and I watched this spot. I did come home and put my Blue Emu lotion on, and I went to sleep and I was fine. I was able to do my mouth exercises even with the little bit of pain. Um, so I would say that my silver lining for the day was having my family with me for the first time. I was missing my son, but he was with me in spirit. And I will say that I had a conversation with myself and with God before I walked in. And I decided that I needed to look at the machine as my friend and not the enemy. And so I feel like um, God is using this machine to take care of any problems I could possibly have down the road. So I've decided to see the machine as my friend, and I think I've made peace with that. So I was able to think about my breathing and slow it down. I was able to think about some happy times that I've spent with my family and my friends, and that really kept my mind occupied because I have a lot of memories to draw on. So that would be my silver lining. Um, so I go in a little bit for my second appointment. So it's goodbye for now. I'll see you in the Fave Paper.